I've talked about this before, but I just wanted to throw in a quick video about medicines and breastfeeding. So oftentimes people avoid certain medicines or don't treat themselves, don't take care of themselves the way they need to if they need to take a medicine when they're breastfeeding. But in fact, the vast majority of medications are safe with breastfeeding. Unfortunately, we don't have the ability to do kind of the best kinds of studies on medicines to determine safe versus non-safe. So we have to do a lot of extrapolation based on the size of the molecules and how long they last and whether or not they're known to get into the breast milk at all. Or if it's in the breast milk, can the baby even do anything with it orally, because all medicines are available when you take them by mouth. So there's a lot of things that go into this, and there are great resources for what is okay and what is not okay. So there's a organization called Infant Risk, and they are available both to breastfeeding moms, but also to physicians and other healthcare professionals to reach out to them and to check their resources. They have an app that is made for moms called Mommy Meds, and that's something that you can download and put on your phone and also look up. I do recommend doing this in conjunction, usually with a physician's guidance as well, so that you can discuss pros and cons, because the majority of medications still will be labeled not the absolute, we know that they are safe, but in the range of it's probably safe or it's possibly safe, depending on how much data we have on it. So you still want to take, what are the benefits of me taking this versus the risks of me not taking it, versus the very small potential maybe for the baby to have some sort of effects. So there is something that goes into that decision, and I wouldn't just recommend taking any medicine just willy-nilly. But if you are told that you should pump and dump, or that you can't take a certain medicine because you're breastfeeding, or your physician chooses to put you on an alternative that is not necessarily first line for whatever your issue is because you're breastfeeding, you may want to use these resources yourself, ask your physician to use these resources, or also just reach out to a breastfeeding professional, like a breastfeeding medicine physician, who can give you some guidance on that as well. There's one other resource called LactMed, and this is actually part of the National Institute of Health library, and this has a lot of the same information that Infant Risk has. And this is really the key resource now for health professionals on breastfeeding and lactation and medications. So this is a great place for your doctor to go look this up, to be able to make an educated and informed and evidence-based, as much evidence as we have, decision about whether or not it's safe for you to take a medication. So that's just a little bit in a nutshell, just so that you know where the resources are and don't necessarily trust a recommendation to pump and dump or to not take something unless you've checked maybe a couple of resources and with people who may know a little bit more. It's always okay to pump and dump for a day or two until you can get the full story. And there are some situations, both in terms of illnesses as well as medications or treatments, that it is unsafe for your baby if you are breastfeeding. So there are some situations out there. Have a wonderful, wonderful day. Bye-bye.